We do not seek attention. We pay attention. We are often judged by award committees. We question the fiction in science fiction. We are going places and virtual places. We are NYIT, and the future is ours.
Hello everyone, welcome to this afternoon's discussion. My name is Dr. Lisa Sparacino. I'm an assistant professor in the Department of Nursing in the School of Health Professions at New York Institute of Technology. I'm joined this afternoon by Dean Sheldon Fields, who earlier this year published an op-ed in The Hill in which he argued that the United States is experiencing a massive demographic shift as Americans grow grayer and more ethnically diverse. This new reality will put an enormous strain on the healthcare system, which is ill-prepared for it. Case in point, Field cites America's looming nursing shortage. Dean Fields joined NYIT in 2017. He's responsible for building on the school's research infrastructure, adding new and innovative health degree programs, expanding alumni relationships, and recruiting and retaining diverse base of faculty, staff, and students. And just a reminder, I'd like everyone to love, like, and share this post. I'd like to encourage everyone to place questions in the comments sections, as at the end of the presentation we will be answering these. And when you put your questions in there, please include your name and where you're from.
Absolutely. We're going to talk everything nursing. No question is unfounded. Would love to hear from you also.
Yes. Oh, I'm going to get started, okay?
Yes,
with
absolutely.
my first question I have
Go
to
ahead.
ask you is, why is America potentially facing a nursing shortage?
So there's a couple of reasons why nursing, which is the largest healthcare profession, could potentially still be facing a shortage. Even though we have roughly about 3 million so nurses or so, the population that we serve is getting larger. So the population continues to grow. People are living longer. Just because people are living longer doesn't necessarily mean they're living healthier. So there's more people to actually take care of. That's one reason. The other reason has to do with the mix of nurses, the population, which is growing, becoming more ethnically and racially diverse, culturally relevant, culturally sensitive care. So do we have the nurses in place that mirrors the growing diversity of our populations, that really understand those populations and know how to take care of them with respect to their cultural points? That's the bigger picture. The other thing is, the average age of a working RN is well into their 50s.
Yeah, that's
we are
true.
going to have a wave of retirements. And we are not necessarily planning to replace those nurses in the numbers that we need in all the areas that we need, the subspecialties that we need. So we are going to have some shortages.
Yeah. I can see how that will be, okay?
Absolutely.
Especially with the retirements of a lot of different nurses.
Yes, we have to retire at some point.
Okay, what about the changes in the healthcare system itself? How will that impact the number of people who are in the nursing profession and those entering into the nursing profession?
So, as all of you know, there's been lots of talk about our healthcare system, the potential changes in Obamacare from the current administration. And when we passed healthcare reform, we gave a lot more people access to healthcare, or potentially, but we didn't necessarily change our healthcare system. The system is still clunky. We did health insurance reform. We didn't do health systems reform. So, do you still get to see a provider? If in those states that expanded Medicaid, for instance, if the Medicaid expansion goes away, How are people going to pay for their services, get access to that whole other pool of nurses that make up what we call advanced practice nurses? Nurse practitioners, certified nurse midwives, clinical nurse specialists, certified registered nurse anesthetists, a lot of whom are paid through that expanded Medicaid program for the services we provide in critical access hospitals, in rural areas, in places where we don't have enough physicians. So anything that tweaks that formula, that changes those payment structures, is going to affect nursing and what we're doing.
I can see that. Okay, talking about nurses and that, in your op-ed in The Hill, you discussed the role of advanced practice nurses.
Yep.
A lot of my students have expressed an interest in becoming advanced practice nurses in various degrees, nurse practitioners, nurse midwives, for examples. How will the changes in the healthcare system impact them and, of course, the patients?
So it was just back to my point that I was just talking about. If we don't provide money and support legislatively through like the Title VIII program that Congress provides, those are federal dollars that flows in to support the education of the future nursing workforce. And if that is a problem, if we're not able to fund as many people to get through school, if we don't have federal loan repayment programs so that people, when they graduate from those programs, can afford to pay back their student loans, people are not going to go into those programs in the numbers and in the ways in which we really need them to. And the opportunities are there. If any of you out there have gone recently to a clinic, say in a Walgreens, or the clinics that are in some of our airports, or even Walmart, everyone has a Walmart. I know you've been to one.
Yep.
But if you go to those types of clinics that are popping up, most of those clinics, which provide immediate access to flu shots and other types of immediate health care that people need, they are staffed by advanced practice nurses, mainly by nurse practitioners. And it's a touch point for people. It is giving people access to the types of services that they need. Again, if we don't have the workforce, all of those things are going to start to go away.
A lot of these programs that are out there are excellent, okay? And I agree, they need to be expanded. But how would you think that there would be a plan to get more men into the nursing profession?
So okay, that's a good question. And I still get really interesting comments and stares and things from people when I tell them I'm a nurse. And I've been a nurse for about 30 years. Yeah. But when I entered the nursing profession, we were probably 3% of the profession. We now have grown to be about 13% of the profession.
Still a very small number.
Still a very small number, but we made some very interesting progress. And one of the ways in which we did it, and one of the ways that we get more men to come in, is we developed really great programs in nursing to work with med techs and folks that were coming out of the military who had medical training, and to help facilitate them through a nursing program. Most of those coming from the military were men. We developed advanced standing programs. So, lots of folks who may have had an education or a different work life, a degree in another area where there was a downturn in like manufacturing in some parts of the country, certain industries that were very heavily male. So you can come and get into an accelerated nursing degree program without having to redo your entire education. We just need to give you the nursing part. And we have developed those types of programs in nursing that appeal to men who are looking to make a change in their profession.
For a second career.
Yeah, it's one of the things I think we've done really well in nursing. So that is really one of the ways, a couple of ways. And of course, destigmatizing the profession. Nursing is not just a female profession. There are lots of opportunities. People, can come in, make a good living. Nurses they're not lowly paid. and you can work in any area.
That's
A nurse.
the beauty of the nursing
A nurse
profession.
is not a nurse is not a nurse. You can work in the hospital. You can work in the clinics, insurance companies. You can work in rural clinics, urban clinics. I have a friend who works on a cruise ship as a nurse.
Oh, my
all
dream.
throughout the federal government. There's an official White House nurse. I mean, go do whatever you want. It's an amazing, flexible profession.
Yeah, I agree with that.
Yeah.
Okay. Do you have any opinion on safe staffing? What do you believe states will implement safe staffing?
So some states have gone to staffing models that are really all about how do we protect our patients. The hospitals, the patients that are in our hospitals now are sicker. Anyone in a hospital is in a hospital because they really need to be in a hospital. And the acuity of care, that ratio of how many patients can a nurse safely take care of really depends on the medical specialty. A med-surg unit where you may be able to take care of a few more, but when we get to our critical care units, our ICUs, those types of things, they require a different ratio. California tried to do this, and it really does. It pushes the mark because then we have to produce a certain number to maintain those safe staffing ratios. But it's going to be state by state based on their practice law. Do I think it's a good thing? I think it's in the best interest of the patients, but state legislatures don't always have the will to do that, unfortunately. So.
Yeah, I agree, and I think that the safe staffing goes across not just hospitals, but nursing homes and things like that.
Yeah.
I think that we have to work on mentoring our students, okay, especially in areas, specialty areas and this and that, long-term care units, Hispanic serving institutions, those who serve underserved populations.
So, and hey, Lena, there's a question from Lena. So, Lena, I agree with you. And Lena's asking about how do we mentor nursing students as well, because that's part of the shortage, particularly students that are in our historically black colleges and Hispanic serving institutions. Because remember that demographic shift that we were talking about?
Absolutely.
The nation is growing more racially and ethnically diverse. So we need those students who provide care back in their home communities, that really want to go back and take care of individuals that look like them and that, they can have an increased impact. And patients really feel more comfortable a lot of times as well. So I agree with Lena, who's a really good colleague, that we absolutely must be about mentoring those patients, those students, because it's for the patient's best interest. But we don't have enough nursing faculty that are that diverse as well that mirrors it. And that's part of that, we have a bottleneck when it comes to getting people in. Because we also don't have the capacity in our nursing schools. We don't have enough nursing faculty.
Yeah, I know that for certain.
So.
Okay, we have another comment from Orice. Okay, to address the nursing shortage, find funds for more programs, RN programs, evening and day programs.
So, okay, that's part of what I was just talking about and what Congress can help us with. The funding for those programs comes through that Title VIII federal program. And those programs do exist. Evening programs, weekend programs, we have tried in nursing to really find multiple opportunities for people to enter the profession. But if we don't have the faculty and the other resources that can fund them, then we're not increasing that capacity to the level that we need, and we know that.
Yeah, we have Libby here who asks, how does the shortage of nurses impact the overall healthcare team? to include other people in the healthcare profession, OTs, PTs, PAs?
I think that's a fair question. You know, nurses don't work in isolation. We are
Absolutely
part
not.
of the healthcare team. The healthcare team consists of, you know, even our physician colleagues, but all of our other allied health professional colleagues as well. The occupational therapists, the physical therapists, our physician assistant colleagues, you know, the folks that work in nutrition, and even in, you know, some of the other related professions, athletic training, all of those professions. And if we're working in that team, everybody has to be there to do their part. Nursing has a very specific function in some of those teams. The lack of nursing means that those other professions either have to assume some of the tasks that nurses were usually there to do, and it's not always in the most efficient manner. And we have to train them together, you know, into professional education, which is, you know, what we do at our school here.
Yes, we do.
In our School of Health Professions, we have those various programs, and we try as hard as we can for at the time they're here in their education to really train them together so that they really know how to work together, again, always to the best interests of our patients.
Yeah,
So.
I agree. Okay, we have Cynthia. Hello, Cynthia. And Cynthia writes, it's difficult to employ nurses when hospitals only want BSN nurses with experience due to their magnet status. We've seen that locally here as well. I think it's important to allow nurses with diploma degrees and associate degrees to complete their BSN within a time frame.
All right, so Cynthia, the American Nursing Association in 1968 had a statement, a resolution, if you will, that by a certain amount of time, the entry-level degree into nursing would be the baccalaureate degree.
1968.
1968, before I was born. So I know. But we really still haven't progressed to that point. You know, the multiple ways to become a registered professional nurse, really we had to move on from. The diploma really is an outdated way of nurses to enter our profession. The associate degree, which about half of nurses still are coming in. Even the Robert Wood Johnson's report on the future initiative of nursing says that we need to increase the number of nurses prepared at the baccalaureate level. Now, there are programs to help transition those mainly large number of associate degree nurses to get the baccalaureate. And hospitals have all sorts of reimbursement programs. Employers have reimbursement programs. So the RN to BSN completion programs, a lot of those associate degree programs are articulated with baccalaureate programs, making it seamless, a seamless transition. We have to remove those obstacles. So, you know, here at New York Institute of Technology in our School of Health Professions, we're working on a brand new RN to BSN program that's going to be, for instance, completely online. So those working associate degree nurses don't have to come sit in our classroom. It's going to be online. We'll make it accessible to people that can access it wherever and whenever they are. Those types of programs are necessary, and we're working on them. But we really do need to progress the profession and get people to that entry-level degree, really at some point being the baccalaureate.
Yeah, and I took my doctorate degree online, and it was definitely a way to schedule around my schedule.
Yeah.
So let's say you're a younger student or you're looking for a second career. Maybe you can help those people out by giving some insights as to why you went into the nursing profession.
So, you know, I get the question a lot sometimes about why did I become a nurse, and, you know, I even get the question, well, why are you not a doctor?
I get that question as well.
You get that too? Yeah.
Yes.
Yeah. And the quick answer to why I'm not a doctor is because I chose to go to nursing school.
Yeah, I give them the same answer.
There's nothing wrong with nursing school. It really is a wonderful profession. But why I chose it, it fit more with nursing is about that curative model. It fit more with my personality. The opportunities in nursing. Again, you can work at any level of nursing.
Yeah.
And if you're really looking for, anyone's out there is looking for a flexible career, you know, where you don't go to work and do the same thing every day. You know, you can start out in one specialty. I started out working as a nurse. I worked in oncology. I was going to be the next great oncology nurse. I worked at Sloan Kettering Cancer Center here in a city. And I discovered from working at that hospital, working with a large number of HIV patients because of the cancer-related incidences with HIV, and garnered this whole career in HIV prevention that came out of that. You know, but if you don't like a certain area, you can switch. You can work with kids. You can work with adults. You know, you can do orthopedics. You can do neurology. You can do surgical nursing, outpatient nursing. It is so diverse. You can work full-time. You can work part-time. You know, hospitals never close. It's 24/7. And you'll always have a job at some point. So, yeah, and we have multiple ways for you to come into the profession. So if you've never even thought about nursing, you know, visit our website. You know, I'll throw it out there. Come visit our school. We're open. We'll give you a tour. We'll talk to you about your opportunities. We'd love to talk. I talk to people about nursing all the time. So, you know, Lena, what did you say there, Lena, again? That nurses should present at urban, career days, particularly. Okay, I agree with you, Lena. You know, one of the ways that we can get to that younger demographic that might be considering nursing, we do this. We do this here.
We go out.
We go out. We go to our local high schools. We go talk to folks because we got to build a pipeline. And I got to stop running into people who go, I've never met a male nurse or a black nurse or a black male nurse, which I'm both. So, you know, I agree with you, Lena. We got to catch them a lot sooner and talk about how nursing can be a really great profession. It's one of the things, Lena, why, you know, I like, you know, our colleagues' book series. We have a colleague who developed a book series to talk to children about nurse practitioners. Her name is Charmaine.
I didn't know
Charmaine,
that.
are you out there? You're out there, Charmaine. Need to hear from you. It's called Nola the Nurse. She was from New Orleans. And she talks to children about, she developed it because she wanted to talk to her daughter about, and her children about what mommy did. And there were no books out there. So it's those types of things that Dr. Charmaine Lawson is doing that will help us get there. So shout out to Charmaine. If I know you're out there, you're probably working.
Shout out. We have KM here, okay, and she's interested in knowing about what the retention rate is like in nursing. Do you have any thoughts on that?
So, you know, like all professions, people will come in and out. So do we retain everybody in a profession? No. But the retention rate really has to do with work conditions in certain areas. And it ebbs and flows based on certain parts of the country. There is a certain amount of burnout that happens at the bedside, but it's also why, you know, we have so many other areas that people can go into. So if you don't want to be a bedside nurse anymore, you can still be a nurse and transition into education.
I was just going to say that.
Because you know, part of what people don't understand, water. Part of what people don't understand is why we have a nursing shortage is we cannot, in our nursing schools across the whole country, we cannot absorb everyone who applies to nursing school who wants to be a nurse. And why is that? We don't have enough faculty to actually teach them. We don't have enough clinical placements to place them. So if you're one of those nurses and working for a while, you have a lot of clinical experience, you know, It usually requires at least a minimum of a master's degree to teach. But if you're that nurse out there, don't leave the profession. Try teaching. Try imparting your knowledge to the next generation. This way you also stay within the profession.
Yeah, and I think that is. So, well, we have Meg Nye here. Hello.
Hey, Meg, is that a shout out?
Our alumni.
Alumni from NYT.
We love our alumni.
Are you out there working, Meg?
So, actually, we have Rice here asking a question, and that was going to be my next question
Exactly.
here. So, what can we do? And Royce asks about nursing schools are doing, but what can we do as a whole, the government, the schools, as a society to address that nursing shortage in faculty?
So back to what Congress can do, fund that Title VIII monies, federal monies. You know, people come in to be teachers in nursing, they might have student loans. We need to make sure they can do loan repayment to encourage people to become educators. The other piece of this is we have to, at some point, get serious about raising salaries for nursing faculty. You agree?
I'd like that.
You like a raise?
I'd like that a lot.
All right. So here's why. As a nurse, I can make a lot more money working out in the clinical arena. You know, a lot of nurses actually take pay cuts to become teachers, and that's wrong. And it becomes a disincentive for certain people. Now, education is flexible. It works for some people. But, you know, the drastic differences in pay, we have to really address.
Yeah, I would definitely like that. And we see Cynthia here talking about that in New Jersey.
Yes.
They have a loan forgiveness program. And I think that many states do.
Yes.
Maybe some states still do not. And I think that's what you were talking about, helping with the title there.
Yeah, and that's why I say the Title VIII monies that flow into from our federal government to all states, we need to do more to encourage people, but we got to have the resources. So I completely agree with you. We have a shout out from Dr. Cahill, Sandy Cahill from NYU. Hey, Sandy, you're welcome. Thanks for tuning in. We really appreciate it. Hope we're doing some good out there. In terms of what we're trying to do here with a topic that not a lot of people are paying attention to, but it's one from my perspective
that's
as
very
again
important.
We're the largest healthcare workforce. It is nurses.
Yes.
It is not physicians. It is nurses.
Mm-hmm. And I think there's Sabrina is asking about if a black male nurse is rare. Well, personally, I think a male nurse is rare still. As you mentioned, only 13%. But
exactly. Well, Sabrina, I started talking earlier that when I became a nurse, and I've been a nurse for about 30 years, when I became a nurse, men were about 3% of the profession. We're now about 13% of the profession. But as someone who clearly is a black male who is a nurse, I've walked into rooms and I felt like a rare unicorn. I have. But there are more of us than what people think. The National Black Nurses Association, whom I'm a national board member of, the American Assembly of Men in Nursing that exists, have always been trying to encourage more men to come into the profession. So we our numbers aren't great, but we are getting there.
Okay. Chihoki says...
Let's go back.
Yeah, you can pronounce the name.
This is one of our new members for our local chapter of the National Black Nurses Association.
Okay.
And I was talking about his name the other night. So
so I just butchered it.
Chi-Ji-Okay.
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 Okay, sorry about that.
Hey, Chi-Ji-Okay. So the question that he's asking is, but you're a doctor, but not a medical doctor. So is nursing force doing a good job of educating the public about what nursing is? I think this would play a huge part in attracting people to the profession. So I agree with you. Remember, we joked, and when people go, well, why are you not a doctor? I actually am a doctor. I have a Ph.D. I'm a super doctor. I'm a doctor nurse. And we go back to the fact that no profession actually owns the moniker doctor. Physicians took it on, and a lot of times some of them believe it's only theirs. It's not.
Yeah.
The highest earned degree that you can actually get in the country is a Ph.D. I have a Ph.D. I'm a doctor. And when I introduce myself to my patients, even in clinical practice, I would simply do it as, good afternoon, my name is Dr. Fields. I'm your nurse practitioner this afternoon. How can I help you? And then you have to educate people about the differences.
Yes.
You have a clinical doctorate. You have a doctor of nursing practice. And you're also a doctor.
Actually, I have a PhD.
Oh, you do. I forgot.
do.
But my whole point is, there are folks out there with clinical doctorates as well.
Yes.
And even clinical doctorates in other professions. The PharmDs, the DPTs,
They're doctors
the
as well.
OTDs. Everyone's a doctor. But it's a clinical title in some areas. And we have to educate people that you really can go on, get an advanced degree, become a university professor, do research. It's how we expand the nursing profession. And in academia, we need people trained at that level in order to train the next generation. So we'll get there.
I do agree with that. We have a shout out from Pamela. Great response about the opportunities and versatility in nursing.
Yes. Very versatile profession.
I do have one other question here for you at least, okay, before we take something else. And, nurses are problem solvers, and that's what a lot of us think that we are. So when you talk about this looming nursing shortage, should we consider this an opportunity or a challenge? It's
both. But I choose to be more optimistic, and I look at it as an opportunity. The future report on the initiatives on nursing gave us a roadmap for what our profession could be in the future. And in that report, it calls for nurses working up to the full extent of their licensure. That will help us with this shortage, potentially. Even those who are registered nurses at the entry level need to be able to work up to the full extent of their licensure, especially those of us that are advanced practice nurses, the nurse practitioners, the certified registered nurse anesthetists, all that whole group. We should have independent practice, and we should be able to practice to the full extent of our license because we do it very safely. Nurse practitioners last year saw well over 1 billion patient visits safely. So no more of this, we're many doctors, we don't want to be that. It's not true. We provide a very valuable service in primary care. We do it safely. And our patients come back to see us because they love us. They love what we do. And I don't think there's a problem with that. So anyway.
Well, we have a shout out from Sandy who says, yes, nursing faculty here. Please consider a career in academia to educate future nurses. Absolutely, I agree with you 100%.
Yeah, it's the only way we're going to do it.
I actually think that I consider a nurse educator an advanced practice nurse as well.
Absolutely. Absolutely.
So
Absolutely.
I do that to things. So, when you talk about a lot of different things here, we have Lena asking here, what do you think about bridging MSN programs for individuals with a bachelor's degree and other disciplines?
So one of the things that I think we've done really well in nursing is really tried to break down those obstacles. We have lots of people who have careers and degrees in other fields that want to come into nursing. And we've made a way for them to do that. We have the accelerated baccalaureate programs. And you can have a degree, say you went to undergrad and you got a degree in biology, chemistry, psychology is really popular, sociology, any of those areas. We can give you the nursing piece of what you need is in the upper division major in about 2 years. Some programs are a little shorter, but they're quick, they're accelerated, you got to work. And then there's another way that these entry-level or bridge programs to take those people who are baccalaureate prepared straight to an entry-level master's. you know. And that's another option. And those programs I actually really like as well, because we're enhancing what they really are bringing to the table, and we're getting them at a higher level in nursing. So we're potentially creating a future nursing workforce that can become educators quicker, because you know the minimum of that is a master's degree, and they'll have that. A couple of years of clinical experience, we can put them in a classroom.
Yes. And also, I was just thinking, as you were saying that, about nurses to go back for their MBA. And we have Petula here saying entrepreneurship. Nurses need to be encouraged that they can own their own business and to be present and involved in operating a healthcare institution.
Yes.
And she's saying that business courses need to be encouraged at the undergraduate level.
Well, you know, Petula, I don't necessarily disagree with you. And nurses are entrepreneurs.
Yes.
You know, there's lots of advanced practice nurses out there running their own clinics in all kinds of areas. You know, there's nurse practitioners out there, you know, doing amazing things. You know, one of my really great colleagues, and shout out to Dr. Margaret Fitzgerald, who, you know, if anyone has been through a nurse practitioner program, probably knows, you know, her textbooks for preparing NPs to take their licensure exam and their certifications. You know, she's a perfect example of a nurse entrepreneur. You know, if nursing isn't at that table, you know, with those innovative ideas. But we got to also stop putting roadblocks in front of nurses. So do I think every nurse should have some type of business or a basic business course? Yeah, absolutely. You should understand how it works. And you can do that. Do we need to incorporate, our undergraduate programs sometimes are also so full with what they need, but people can get those courses all throughout their career.
Yeah, I think at NYIT, I know the nursing leadership course inflicts a lot of business, scheduling, budget management within that course, which is helping them think of that business sense.
Absolutely.
Preparing our future leaders.
We have another question from Juliana.
We need more mentor-type programs to help those who want to be educators learn how to move into the education role. So many are just thrown into teaching with no experience.
Well, Juliana, I don't know where people are doing that. I can assure you, here at NYIT, we don't throw people into teaching.
And I have to agree with you, because I came here as my first teaching job, and I was well mentored by the senior faculty here.
But here's the thing, Juliana. You know, remember I made a comment earlier that there are some wonderful nurses out there that have been practicing for a long time. They have excellent clinical experience that maybe want to transition from that clinical area into teaching. You know, and we do need to mentor them. We really do. We need to guide them through, you know, because academia can be a little vexing at times itself.
Yeah, a little bit.
You know, but I would never put someone directly into that. I would bring them in. We would have them do some co-teaching, maybe start out as even being an adjunct. And I agree with you that we do need to mentor them to make that landing into academia something that they could sustain.
Okay, Dean Fields, we have one more shout out. Thank you both for such an informative session. Thank you very much for everyone participating. And I'd like to remind everyone to check out our website, www.nyit.edu/nursing. Dean Fields, I'd like to thank you for joining us this afternoon. I think it was very informative.
So I hope it was helpful. This was fun. So. This is my first Facebook Live, so I don't know how many people. I don't know how many people we had out there, but I really hope it was helpful for folks. And it's going to be recorded. I can't wait to see some of the comments from later. And again, I really want to just say to you all, you know, there's so many wonderful nursing programs out there. You know, we do have one here within our School of Health Professions. And again, it's all about how do we encourage people, to look at the profession as a potential opportunity. There's lots of opportunity. And, I will always answer questions about nursing. I love my profession. So even after this, if you all have questions out there, send them along. Be happy to talk with you. So, and I thank you, Lisa. This was pretty good.
Thank you. Yes.
Yes. So.
Bye.
Not many people think about how similar our nervous system is to an electric circuit. But as bioengineering students at NYIT, we can't help but see things this way. The secret bioelectric conversations between the stomach and last night's meal will soon be decrypted. We are NYIT, the Stomach Whisperers. And the future is ours.